One to go.
Here I am today in Galliano Island, just off Vancouver, and I'm interviewing Larry Campbell. Larry Campbell is a retired senator for the province of British Columbia in the federal government of Canada, and among other things, he's been the coroner for British Columbia and also the Mayor of Vancouver. And Larry has been a real trailblazer in addressing the issues regarding drug addiction and the loss of life in the city that he loves. Larry, thank you for taking time to be with us today.
Thank you for coming to our beautiful island, and I'd just like to add one thing. My first career actually was in the Royal Canadian Mounted Police, where I spent 9 years working drug squad. So welcome to British Columbia, and you brought the Australian weather with you. I love this.
That's lovely to be here. So I'd like you to address today the issues we've been discussing around the 4 pillars of supporting people with addiction, and you've had a lot of experience that you will share with us today.
Well, there's too much to discuss in a short period of time, but the main issues that I like to deal with is, first of all, saving people's lives. I think that that's incumbent upon all of us. I think developing and using policy that shows results and actually works. And third, but as important, taxpayers' money that is spent on addressing addictions, which is a medical problem, not unlike any other medical problem. And the fact that by addressing that through the 4 pillars, you find yourself with lower costs for emergency room, police costs, social services, healthcare nurses, you name it, and the disease we call addiction affects those bottom lines. And so not only is it good because we should be trying to save people's lives, but it's good because it also is financially responsible. I'm a politician. It wasn't my first line of work, but I was a politician. And so I was constantly, as we all are, constantly thinking about what are we doing? How do we spend our money? And are we getting the best results? And when you look at 4 pillars, you realize that at one point, harm reduction needs to be up there. So supervised injection sites, needle exchanges, everything, Narcan, everything to do with harm reduction. Prevention, to me, it's an underutilized pillar because we know that we can identify people who are having troubles very early on in high school. I think probably the people most are the guidance counselors, or at least what I had as guidance counselors. They understand people who are dealing with poverty, racism, abuse, just being a teenager. And if you can't understand what that term of just being a teenager is, then I'm probably not getting through to you. Enforcement is important, but enforcement is only important from the point of view of interdicting the drugs that are coming into your country. Arresting addicts, somebody who uses drugs or sells drugs to support their addiction, is counterproductive. It's a waste of time. For the most part, nothing really happens. And with the way, being a former police officer, with the way police work is now, you're going to spend hours and hours and hours of precious police resources filling out forms, documents, what have you. Treatment. Treatment is one of the critical areas because, and here are the issues with treatment. First of all, it has to be on demand. So if I'm an addict and part of my addiction is that I need drugs, if I find a moment where I say, you know what, I got to stop this, I need to go into treatment, and we don't have it. You don't have it. And so treatment is critical. Here in Canada, in Alberta, the government pays for treatment. So if you need treatment, hopefully you can get it. They haven't reached the point yet where the critical mass, where they have enough spaces, but they're working on it. And so treatment is critical in this whole thing. And I don't differentiate between treatment. I don't differentiate between total abstinence or at the other end of the scale, some people are going to have to be given medication for their whole life. I had cancer. I take medication all the time. If you're an addict, it's a medication. And so I think that, the 4 pillars, everybody thinks they're level, but they're really not. They're up and down. From a political point of view, if you believe that addiction is an evil, evil thing, I don't think I'm going to get through to you. If you believe that addiction is a medical problem, that a person gets themselves into for any number of reasons, poverty, abuse, racism, lack of education, self-esteem, if you understand that, then you know that they're in deep pain. And what they're basically doing is self-medicating. I was a coroner for 20 years. I met people who were addicted every single day. Not a single one of those people ever said, "Am I ever glad that I became addicted?"